Okay, our next speaker today will be Dr. Li伯璋署长. He's a trained surgeon and an expert on organ transplantation from the National Cheng University. He has been in the field of organ transplantation for many years and then got many awards for it. He's also currently the Director General of the National Health Insurance Administration under the Ministry of Health and Welfare. That is the Center for Medicare and Medicare for you from the U.S. Okay, so in the U.S. it's like $2 trillion of budget. In our case, we have about $400 billion of NT or something like that. But I think Dr. Li will explain that to you. So let's welcome Dr. Li.
Okay, thank you. It's my pleasure to be here to share my experience with all of you. Actually, as you made Professor Li mention, I'm a renal transplant surgeon before for 38 years. Yeah, and last year during the May 20, I was assigned this job. And for this year, I try to do my best to offer Taiwan people good health care. And also, I wish the Taiwan medical professional will be happy in their work. Yeah. And today, I think most of the audience, several of you come from the United States. Yeah. And most of them are Taiwan people, and some of them just a medical professional, and especially the physician, and others maybe belong to different group. Yeah. Today my talk is talking about improving the health care. And okay, maybe you already stay in Taiwan, yeah, but Taiwan is a small island. However, I believe Taiwan is a very good country, and the people here are very friendly to all of us. And this is just a picture when during the May 20, I went to Swiss to attend WHA, and I just show the people there to know where is Taiwan. Yeah. And the Taiwan NHI is very world famous, yeah. And we know it covered almost 99% of the Taiwan people. And in Taiwan, 93% of the medical professionals, they have a contract with our NHI. Yeah. So in that situation, the most people can have a good health care. Yeah. And you see, we have a very good system. We have the medical center, we have the regional hospital, we also have the clinics. Yeah. So in that situation, yeah, we cover all Taiwan people, and we also, in some, especially in the mountain, yeah, we also have the IDS system. To give them good medical care. We send the doctors there and also nurses there to give them good care. So now today my talk is that you can see the Taiwan people are very satisfied to our NHI, almost maybe more than 84%. Our minister here, yeah, he said almost for all government organizations, the people are always not very satisfied to us, yeah. But the NHI is quite different, yeah. And this year, we all have a 2.9% increase of the satisfaction. However, you see, the Taiwan medical professional, they are not very satisfied to our NHI, yeah. I was thinking 30% satisfied to Taiwan NHI. So it means that people are very happy, but the medical professionals, medical providers, they are not happy. This is the problem. Yeah. So we have to know why they are not happy. But as I mentioned, that 93% of the medical specialists, they have a contract with our NHI. So they don't know, they are not just, they cannot come together. They just say, I don't want to have a contract with the NHI. They just very unhappy and very always complain. But they are not so have many courage. Yeah. But since I come from the medical profession, yeah, so I think I have to find some problem. Yeah. So this is now I want to just tell you some true facts. What happened to our NHI? This is also just we get information from our NHI big data, and this is the reason why I can come here to share my information with all of you. Yeah, you can see in the beginning, since 23 years ago in NHI, our budget, and this is now the budget almost 3 times increase. Yeah, but where are this budget going? Yeah, we see to be the government. It's not easy for us just to get a premium from our people. Yeah. So in this situation, I think for most of the medical professionals, they are not happy. They think our premium is not enough. We should get more for our people. But you know, if the government they just try to raise the premium for the people, maybe soon, yeah, we'll change. Now it's a DPP party, yeah, but then maybe we'll go back to KMT, yeah. So this is the problem. So I think how I can do this, yeah. And you see, we say now we have the fund to cover our NHI, but if we don't care how to reduce the cost, maybe during the 3 years later, we should increase our premium. Yeah. So I think if I just see the natural cost, I mean, of how we spend money, yeah, I think it means nothing. I think I don't need to retire from National University to work here. Yeah. My problem is that I want to do something for our Taiwan people. So if I can make good use of our premium, yeah, I think it's good for me. Yeah. So this is the problem. You see, as you know, this is from our data. This is just, I mean, the people, they stay in the inpatient. But this is, I mean, the people, they are in the outpatient. We see the expenditure is quite different. So now we also know, generally, the patient, they went to the hospital, they should be in critical situation. So they stay in the hospital. In that way, we need more personnel to take care of them. Yeah. So we need more cost for them. However, we spend that money in the outpatient clinic. It means this is just a reverse the true situation. Yeah. So you see, we say now in Taiwan we don't, for most of the young generation, they don't like to be the surgeon, to be a physician, and to be the pediatrician, and to be the obstetrician. So this is the problem. Most of doctors, they like to do something easier. They don't need to, I mean, to have a duty during the night. Yeah. So this is, it means that our medical expenditure, I mean, this is a big problem. But you know, this is just a trend. This is just not a fluctuation. Yeah. So it means we have to face our NHI finance situation. Yeah. So you see this one, we can see for the green line, it means a treatment. It means that we spend the money just for a level test. For example, we did the CT scan or the MRI, we draw the blood to do the liver function test or renal function test. So the first of most of these, the payment to the medical performance, it all go to the medical the hospital manager. Yeah. But the second one is the drug. Yeah. So we spend a lot of money in drug, and recently in Taiwan, yeah, we try to see how much drug can be collected. Yeah. It means that many patients, they went to the hospital, they get prescription, they get drug. However, they don't eat it. They just waste that. Yeah. So it costs a lot. Yeah. And recently, the WHO also pay attention to this. This is a pollution problem. Yeah. So this is, we can see, we have almost so much the percentage of the cost in this part. It is very serious. However, for diagnosis, it just means that for some specialists, medical professionals, what they do, we pay for them. That's why you can find that we pay them a very, very few. Yeah. So it means that even we say in Taiwan we have a scope. So for example, you perform the operation, perform the appendectomy, we give you, for example, we give you 10,000 score. Yeah. But in the past, 10,000 score means 10,000 money. Yeah. Taiwan NT dollars. However, in Taiwan, even you give him the same score, but it means there's a half of the payment. Yeah. So this is a problem. So we think in here you can see this is written in Chinese. Yeah. But for most of Taiwan people, you can see this one. You pay a lot of money here. We pay a lot of money in drug, and only for the medical professional. The percentage. It decreased a lot. Yeah. So this is a problem. It means that why all the medical profession, they are not happy in Taiwan. Yeah. And I think it's very necessary. So for me, I try to fix the payment for this one for diagnosis. And to that, the level test to be fluctuated. I think this is a very good way. So I believe in Taiwan, it's quite different from other countries. Most of the people here, because of our traffic is very convenient, so most of them can go to the medical center. It's very easy. We don't restrict it, although we don't let them to go there. Yeah. So in that situation, I think the medical center bigger and bigger. Actually, I'm graduate from the Taipei Medical University before. I think 38 years ago and more. 38 years ago, I graduated from the Taipei Medical University. But now we come here. But you know, our campus was there, yeah. But our university also increased, so we also brought this campus. And I think maybe another campus over there, yeah, 101. There is also one campus, yeah. So for medical university or medical center, they have increased, but we try to have the reverse system. We wish our local clinic or local hospital, they can grow and take good care for a patient. But for the medical center, we try to restrict them to just to take care of some, we say, the critical care patient. Yeah. So how can we then perform this performance there? First, we think pharma crowd is very important. Yeah. This is in Taiwan. Yeah. It's easy for us to have the drug, and our co-payment is very few. Yeah. And even we have we can depend on how much money you can pay in Taiwan. Irrespective of how much drug you have already got, your maximum is $6 that you have to pay. But I think in that situation, yeah, many people here, yeah, it's easy for them to get drug. So this, I think, how can we reduce some? We call avoid the duplication of medication is very important. So we try to set up the pharma crowd situation. Yeah. So recently, you can see. We can then last year when I became this job, yeah, we try to reduce what we call the duplication of the medication. So if you prescribe the drug repeatedly, then we don't pay money for the pharmaceutical store or for drug store or for some another hospital. But they are always very angry. But now we try to revise our pharma crowd. So our pharma crowd is very easy, and for some medical professionals, it's easy to know, the last doctor's what prescription he has done. Yeah. So in that way, we don't repeat the medication. And all of you, they are very smart. But I mean that if you want to do something good, yeah, we have to ask to get advice from some medical professional. So for this pharma crowd, we ask some doctors. They have the private clinic or some medical professional in the drug store. Yeah, they give us some information. So we revise them. So you can see we call the timeline of the patient medication record. It is easy for us to find in the pharma crowd. And we also see how many drugs you already got already. Generally, for some chronic disease, maybe it's easy for them to get a 28 days drug or 30 days drug. Yeah. So maybe 2 weeks later you go to the hospital to get drug again. Yeah. So in that situation, we try to let all doctors know, this patient, how many drugs he still have. Yeah. So in our pharma crowd, we have such kind of information. Yeah. And in Taiwan, our situation is quite from the United States. In the United States, you have some opioid, medication very, very frequently. It's a big problem. But in Taiwan, we also have 6 kind of control drug. In that situation, for our people, it's not easy for them to get such kind of drug. I think it's good for our people. Yeah. And another thing is very important. We say the medical crowd. What did we say that in our system, NHI system, we can get many information over there. So for example, this is just, we say the examination results. Examination results means that in the beginning, I just told you that in Taiwan, we have spent a lot of money in some laboratory tests and some study. Yeah. So I think it's very important. So in this way, we wish for the doctors can know which kind of test already been done. So we can see this is the top 20 paid laboratory test. Yeah. For example, CT scan, MRI, abdominal sonogram. Yeah. This is always be performed very frequently. Yeah. But this kind of performance, we need to pay money for them. Yeah. So in Taiwan, one patient, he ever been done the brain CT scan for 27 times per year. 27. But you know why? Every time he go to the hospital, especially he go to the emergency room, and he say he got an accident. And all the doctors say, oh yeah, maybe we are scared, maybe you got a head injury, and then we have some and we say brain breathing, yeah. So maybe subdural, epidural, yeah. So we did the CT scan. But you know, CT scan has has some, you know, in the emergency room, maybe the CT scan always be done with the non-contrast and non-contrast. We don't perform the contrast the CT scan. So sometimes for this kind of the diagnosis, they are very accurate, yeah. And you know, it's very short time, and he performed and nothing. And 2 or 4 days later, he go to the emergency room again. Yeah. He also said he got accident, and you know, we scared. Maybe this is the head injury, and maybe the headache is due to the delayed bleeding of the head injury. Yeah. So we do the CT scan again. Yeah. So 27 times. Yeah, and you know, we think we have such a problem. So and we ask our people to give him the consideration. Yeah. And then after our consideration, yeah, he still got 10 more times, yeah. So totally 37 times, yeah. And then we think that maybe there is some problem. I want to say that in the beginning we are afraid that he has some problem, not only due to head injury. Maybe he has, a neurologic disease or psychiatric disease, or some kind, maybe cardiac disease. So every time he walk and he get dropped and he go to the hospital, yeah. But you know, for this 37 times later, yeah. We try to do something else. We ask, we say the insurance company, yeah, to see whether he has any insurance coverage, yeah, and commercial insurance, not our national health insurance, yeah. So we found that he has 13 commercial insurance, yeah. So every time he got accident, he go to the hospital and he had some treatment and he got the receipt and he go back to the commercial insurance to get the repay, yeah. So I think we have to learn a lot how to manage our national health insurance. Yeah. So you see here we can see we have many different we say this top 20, and this top 20 now we monitor each patient they have what they have done. So you can see for this kind of CT scan or MRI, yeah, they are performed a very good increase gradually, and frankly speaking, the payment are all go to the hospital manager. Yeah, not to the medical professionals. Yeah, so this is a problem, and why our medical profession they are not happy. Not only the doctors, I think the nurses and the pharmacists they are not always very happy. They think they are very busy. They didn't get the worthy reward. This is a problem. Yeah. So we say our pharma crowd, medical crowd. We always put there when each patient they go to the hospital. And the doctor in his monitor, yeah, he can see, oh, Po Chang, you come to here, and within this 1 month, yeah, what kind of test you already done? Yeah. So in that way, okay, for example, if you go to a Taipei Medical University to see the outpatient clinic, but maybe 2 weeks ago, you go to a National Taiwan University, you also have performed the CT scan. This is just abdominal CT scan to see whether your liver has any problem. But you go to Taipei Medical University, also you have compared the right upper quadrant plan. Maybe you also have liver problem, or perform the abdominal CT for you. Actually, it's right. But you can see no difference compare your study in the National Taiwan University. Yeah, so it means that your performance is not necessary. So I cut your payment. Yeah. So in this way, we try to reduce the unnecessary level test. Yeah. So recently, yeah, we try to let all the medical professionals know what is our pharma crowd or medical crowd. Yeah. So we can see many hospital personnel they are doing such we call the medical pharma crowd. And for the drug, yeah, I think the duplication of the medication decrease gradually. Yeah, I think this is very important for us to control our medical expenditure for some medical performance and the drug. Yeah, and another topic is I think it's very important for us to improve. We call my health bank. Yeah, this is what do you mean? What I want to mention is that also begin now. Next. Okay. This 3 years ago we built this my health bank, and during that time I think our minister maybe you give them the prize. Then this is my health bank. Yeah. And this means that okay, in our everybody in your cell phone, it's easy for you to run your my health bank. And Professor Lee also went to our national health insurance. I mean, to give some comment about my health spec. Yeah. It means that for me, I think, yeah, my health spec have many my medical information. Yeah, and I wish in Taiwan maybe for our parents, they go to hospital when they come home. You ask him, Papa, what the doctor have talked to you? Maybe you don't know. Papa say, I don't know. The doctor say, oh, then he didn't know what's the answer. Yeah. But I think this is a good interaction between the family. Yeah. So if I didn't know, Papa go to the hospital, what the doctor told him, I can through his health bank, yeah, and see what his level test, what kind of medication he has done. In that way, it's good for us to give our family good health care. And this is, I think, is very. Okay. Next, okay. So we can see, I mean, the increase of the people they are using my health bank, yeah. And I think some of you maybe got a prize from our in our National Health Insurance Administration, yeah. So I think step by step, I wish this one to let the Taiwan people they can get give them good health care by themselves. Next, okay. And another one is that you know, in Taiwan, yeah, we also since we have around 10,000 private clinic in different ways, and we also have some regional hospital and some medical center. Yeah. So, for example, if you went to if you went to this is Taipei, if you went to Tainan and to have a sightseeing over there, but you get accident, but you don't know where is the hospital or where is the clinic. Yeah. So in that situation, we have the NHI app, yeah, app, and you can see put your area, yeah, and you can show you where is the local clinic or local hospital. Yeah. In that way, it's easy for you to find the hospital. So I think it's good for us and to let it. And especially during the weekend, yeah, sometimes for some people, they don't know which clinic is open because even we wish all the medical professionals they should open 7 days or 24 hours to take care of us. Yeah. But you know, for the medical professional, they also wish to have their, the vacation. Yeah. So, but some of them have opened. So we have the NHI app. Yeah. I think it's also, something new in our. Okay. So in the future, yeah, I think it's very important that all this kind of health care. Yeah. I think that all belong. I think we have some connection with the AI system. Yeah. So I think our minister, yeah, he is also a specialist here, yeah. So I think it's good for us to Taiwan to have a good interaction and integrated medical care. Yeah. Next. Okay. So this is during when I went to WHA, yeah, when I came back to the president's office and the president's side, yeah, I just told her that I think we are proud of our NHI in the world, yeah, and we try to improve our NHI system, yeah. But actually it's not easy, in Taiwan, yeah. In the past, maybe as I mentioned, not all the data satisfied our NHI. However, they have to have a contract with us. But for me, my thinking process is quite different. I wish them be happy to have a medical practice in Taiwan. So this is, my mission and my commitment to do my job. Yeah. Okay, this is written in Chinese. Yeah, maybe some none of you know. Yeah. Since I'm the medical doctor for a long time, and before I came here, I'm the professor of surgery in my university. Yeah, and I also ever take in charge of one hospital to run the business. Yeah, I think business is business. To be the hospital manager, we try, to make some profit. Yeah. But in my situation, my situation is sometimes different. I think I have to control the cost. Yeah. So my colleague ever told me, Po Chang, why you change your idea? I think I changed my seat. I changed my mind. So this is the problem. And I think my president say that everything should be humor, yeah, humor and more humor. But I think communication is very important, yeah. And I try to do my best to do this job. And I wish all of you, if you have any idea how to improve our NHI system. Yeah, please don't hesitate to tell me now. Okay, thank you. Yeah.
Hi, I think we may have some time for a question or two, maybe two questions.
Okay, thank you, Professor Lee. It was like fantastic to have you here. And my actually comment, it goes to all our hackers. This is the exact presentation you want to learn. You got all problems of Taiwan healthcare system. So don't think anything else, just concentrate on Professor Lee's presentation and try to find solutions at least for one of them. And back to you, sir.
Yeah.
I am here for 7 years, and I really appreciate NHI working and it's like one of the best healthcare system in the world. But what is my concern, small concern and observation is, you are doing a lot on squeezing expenditure. But how about promoting prevention? Like now technology is available, you can measure like lifestyle of people. Why don't you involve these habits into their health bank and give them some incentives? Like if I do more exercise, you are like incentivized, like maybe some points, as you were saying. Maybe you are giving 100 points, so that next time I go to hospital, I don't need to pay even co-payment because I was following my exercise. In that way, maybe you will engage more and more participants.
Okay, thank you. Actually, you know, the national health insurance, everybody in Taiwan, and then everything has connection with the NHI. Yeah. So actually, we have another bureau we call the Health Promotion. Health Promotion Administration, 国健署啊. But you know, actually it is also very important. But everybody, our NHI, we always pay just for disease, not for prevention. Yeah. But I think prevention is more important than the cure. Yeah. Than treatment. So as I mentioned, actually today I don't give you some data. For example, in Taiwan, yeah, we have some patients with hepatitis. And we should give the patient, some kind of prevention but for treatment, you know, we need to pay some money. But some medical professionals, they don't happy to pay, much money because they think it's another story. Yeah. But you know, in Taiwan, we are scared to see the natural cause of the disease. So you mean, for some disease, for example, it's very important. We call diabetes. Okay. Diabetes is very important, but we spend too few money to prevent the diabetes. So you see, recently in the Lancet, we see, oh yeah, in Taiwan we have many chronic renal failure disease. Yeah, and finally we pay more money to take care of this kind of patient. Yeah, but you know, this is also just a challenge for my job. Yeah, but I believe your idea is very important. In the future, I try to make some change, not only to pay money to treat the disease. It's always too late. Yeah. Okay.
Yes. I would like to follow up on this prevention question. You know, everybody's talking about prevention. You know, from the consumer to the medical professionals. But I would say prevention would not work if it's not precise. Meaning, if we just ask everybody to prevent everything, that's not going to work, right? We tell everybody to prevent diabetes, everybody prevent hepatitis, then, you know, the life is kind of boring. You know, you cannot eat this, you have to do that, and there's just 1,000 things to do to prevent all the diseases, right? So we're sitting on a treasure of very, very big data. I'll just give you one example that we just use the diagnosis that were given to patients with risk to hepatitis, to hepatoma. We're able to predict about, with 80% accuracy, when this patient is going to get hepatoma, you know, within 1 year or not. Okay, so if I'm a patient and based on the NHI database, I know I'm going to get a serious disease in a year, like diabetes, cancer, you know. Okay, if I know that, then I have very strong incentive to actually do everything to prevent it, right? Usually, I know people whose lifestyle totally changed after they're diagnosed of cancer. But that's not wait until they're diagnosed of cancer. Let's do it 1 year before, 2 years before, depends on who you are.
Yeah.
Some people, if you tell them 10 years you're gonna get cancer, they don't care, right? But for some people, most people would care if you say within 12 months you're gonna get cancer, then he will try to do everything to prevent it. That's when you get very strong incentive to prevent. So, okay, so after all that statement, actually what I'm trying to say is, how about we use the NHI database as a very strong, as a base for strong predictions for everybody. So if, like we have 100 people here, if I know I'm going to get diabetes in 12 months, then I should do this and that, right? But if not, then we worry about something else, right? So everybody should be preventing different things. Not everyone preventing the same disease. There are just too many of them. So if we can use that, that will be like the giant next step for the 健康存折, like health passport.
Thank you. I think this is very good information. Frankly speaking, I think in Taiwan, I think education is very important. And another thing is that we have 40,000 medical doctors in Taiwan. Actually, they are all the gatekeeper for us to give the medical care. But however, I think we don't use them very friendly. I think this is a problem. And another thing is that, as you mentioned, in Taiwan, I think one thing is very important is that we have too many, in our NHI system, we have too few medical professionals there. So if you have enough medical professionals, we can get some clinical-oriented research in our big data. This is a problem because sometimes we only have what we call the public health or some medical management in our NHI. So sometimes the idea is quite a little different, far away from the medical practice. So this today, I think all of you are very good. And I think if you are interested, you can give me your idea. What do you want to do research? We NHI will cooperate with all of you and to get to make good use of our NHI data. This is very important. I think. So I heard that some of you belong to the high school student. Please raise your hand. High school student. Oh, good. You look very. Medical commission in Taiwan. Okay, thank you. Thank you.
Any other question? Yes. Okay.
Okay, thank you.
So I think this is great. I think the work that you've done at NHI and the My Health Bank, especially from a research perspective and citizen support perspective, is great. But on the other side, okay, so in the U.S. last month we had a breach with Equifax, which exposed 150 million people to all their personal financial information being exposed. Okay? And so this is the other side, a risk of health data centralization. And I know that there's no easy answer, but what can you talk about a little bit, the things about Taiwan they're doing to protect patient privacy and data security?
Frankly speaking, last month I went to Duke University, and Duke University, I have some conference with them. I think in this world, Taiwan HI system is quite unique. For our country, it's not easy to copy because it always passed that for a long time. And even in the United States, you have too many commercial insurance over there. So even Obamacare and everything. I think that it's not easy. But what we can do is just to do what you can do. This is very important. So recently my boss went to India, and India also a lot of people, and they are also trying to learn something from our Taiwan HI. But so many people. But you have to pay a lot of budget there. But I think beginning is very difficult. But Taiwan is quite different. So I think your question is very difficult to give you an answer. Okay.
No, but there was no incidence of breaching in Taiwan in last 25 years.
Yeah, well, actually, I can add a bit to that because all this national health insurance database and connections, they run on a separate network. It's called the NHI VPN. 叫做健保的VPN 嘛，就健保 VPN 嘛，一般我们叫 virtual private network. So it's on a physically different network. Although in your hospital you could connect to the internet, but that doesn't give you access to the NHI database. So physically it's separated. And I think when Professor Zhang was the when Professor Zhang was the Prime Minister, I think he worked with the major telecommunication company in Taiwan and make sure that this infrastructure is actually quite safe and outside of the internet world. So you cannot hack into it. And most hospitals are very aware that all the hospital systems are also on the VPN. They don't have to go to the internet. So to talk to the NHI, they all within this so-called NHI VPN. So relatively it's safe. Although I thought it was stupid at the time, sorry. When they started, I said, why do you have to establish another network? The internet is already there. So I was against the idea of a physical VPN. I thought a software VPN would be enough. But again, now I think of it, it's probably, I was wrong, you know. That's probably a good idea to have a physical VPN, you know. It's physically disconnected from the internet.
But they say it's very safe and very secure. Yeah, yeah,
It's very safe.
Yeah.
Okay.
And please.
Yeah, please.
Well, this is a scientific forum, so I think it's appropriate to ask this question as well. In the foreseeable future, will NHI adapting any like big data or AI into their, well, because you mentioned about unsatisfied healthcare providers. We're not talking about like the payment systems, about the massive cuts in reimbursement or rejection of reimbursement. And I just wonder if there's a need for more smart system to determine who get cuts or like what the policy in terms of like analyze the data, you know. So well, we're not happy about the reimbursement rejection things. Okay.
You know, in Taiwan we have a review system, yeah. But review system means that for the NHI we don't pay for some unreasonable medical performance, yeah. But for many medical performance, it is always a bias. Yeah. And then recently I tried to ask some medical society to set their guidance. I mean, to let all the medical professionals follow this kind of regulation to give patient performance. Yeah. And for me, I think even you don't pay for some unreasonable performance, but for most of the medical professionals, they are not happy. And I think it's not not so much money there. The most of the expenditure are on the which we call some level test and the drug. Yeah. So I try to reverse such kind of the payment direction. Yeah. So I think maybe give me maybe 3 months or 6 months. I think we make a change. I wish all the medical professionals will be satisfied to our strategy. Yeah.
Any other question? Okay, I think under Dr. Lee's leadership, we're going to have a brand new NHI. Yeah. 那我们拭目以待. Okay, thank you very much.